of patient empowerment. Friedrich Borchers, Charité, Berlin.
Up to 1 in 3 patients who undergo major surgery suffer from postoperative delirium, a syndrome known as fluctuating symptoms such as disorientation, illusions, hallucinations, altered states in sleep-wake rhythms, and deficits in attention, concentration, and memory. Cognitive deficits can be observed in more than 5% of all surgical patients. In 30% of high-risk patients admitted to an intensive care unit, it can be observed even after 1 year, and in the worst cases, it can persist or aggravate well beyond that time. Both postoperative delirium and postoperative cognitive dysfunction have been linked to a higher mortality, a higher level of care at discharge from hospital, less option to return to the former job position, and in addition, treatment is more expensive. At our department, an interdisciplinary team is working on identifying the risk factors to understand the pathomechanisms of both entities and on developing effective prevention and safe treatment strategies. Imagine, waking up. We have learned from our investigations that too deep anesthesia and long-term sedation in the intensive care unit have a variety of negative effects that limit the possibility of early mobilization and early reorientation. So imagine waking up in the intensive care unit after major surgery. You're in a foreign place surrounded by foreign people, equipment noises, you may have pain from drains and lines. Despite treatment, all this can easily trigger feelings of helplessness and anxiety. To empower the patient during the perioperative period, it is our intention to investigate hypnotherapy as a patient support strategy. Hypnotherapy is based on a phenomenon that all of us experience spontaneously several times a day. Like, for example, now listening to 100 short presentations requires an exceptional degree of attentiveness, and from time to time we drift into a state of consciousness that is characterized by focused attention and reduced peripheral awareness. This state of consciousness is called trance, and it might be useful as a non-pharmacologic intervention to prevent postoperative cognitive deficits, but at the same time, it may serve as a model for understanding how to induce neuronal plasticity rather than the loss of neurons. Thank you for your attention. Well, there are some clinics trying it, but that was not our setting. We wanted it perioperatively, so patients had hypnotherapy the day before surgery and two times after the surgery. It's a supplementary intervention we want to do.
Awesome. Thank you very much. Next, please.